Hi everyone, Dr. Ron here. Thanks for participating in this virtual conference. I wish we could all be together doing this, but this is better than nothing. Today I'd like to talk about an issue that's really important related to mental well-being, and it relates specifically to the COVID-19 situation in which we all find ourselves. It's a time of really unprecedented uncertainty, and uncertainty leads to anxiety and boredom and stress and depression sometimes. And these are important things to talk about. I want to talk about how they relate to three areas of your life in particular, and especially how it will affect the development of the brain at this time of life when people are young and their brain is still developing. In the family, there are increased tensions over money and family responsibilities, who's going to do what, who should do what, work, don't work, work from home, don't work from home. And what this often does is put pressure on parents who have to provide for the family, and teenagers who are not children, but not adults either. Nevertheless, at times when there's an increased demand and less time, less money available, teenagers are often asked to step in and take on adult responsibilities that they might not ordinarily be asked to take on. They may feel that they're not capable. For example, teenage kids may have to take care of the younger ones much more. Feed them, walk them, make sure they're okay while their parents are trying to earn a living or work online or work from the home. These distractions are important, and they put extra tension on young people. What I wanted to talk about is the fact that this has led to an unprecedented spike in the use of alcohol and other drugs, including cigarettes, vaping, cannabis use. And remember, even though alcohol and cannabis and cigarettes are legally available to adults, they're used an awful lot by people who are not adults, teenagers. We know that there's been a tremendous increase in the use of all of those substances by teenagers. About half of young people, teenagers that is, use these drugs alone. It's called solitary use. About a third of them use in the company of peers, but via technology over a screen. And about a quarter get together in person to use the drugs. And I'm going to get to that in a little bit of a while, but I think it's important to note that alcohol and cannabis in particular are being purchased at enormous rates by adults, stockpiled in the home and used by the adults. And this use by adults can lead to family tensions, not just when these people are under the influence, but that could lead to fighting and arguing and irrational behavior. And the irrational behavior leads to anxiety, and the anxiety can lead to more use of the drugs. And it's important for parents to realize that if they're using drugs in order to cope with the stresses brought on by this unusual pandemic, they're modeling this behavior. They're telling their kids this is a way you can use to cope with tension and stress, and that's a very dangerous way to model. There's also a great impact on your personal life, your social life. Your social life is essentially put on hold. There's no way you can get together with friends. There's no way you can practice the kind of interactions, personal interactions, that you would with your peers. There's a blurring of routine and schedule. It's hard to even know what day it is sometimes. There can be a feeling of isolation and loneliness. because of the physical distancing. And what this does is this could lead to people feeling less well about themselves, less certain about themselves, and wanting to develop a kind of a fatigue, a COVID fatigue it's called, where they're saying enough is enough, I can't take it anymore, I have to get together with people. And this leads to a cavalier attitude toward wearing masks and social and physical distancing. There's also academic implications that are important to young people. I'm not just talking about the transition to remote or remote classes. You'll get over that. That's okay. Everybody in the world is doing that in every aspect, and you'll get back to that. But what about canceled athletics and extracurricular activities? What about delaying and being very uncertain about post-secondary application processes? What if you can't work after because of shutdowns to earn the grade, not the grades, but the money you're going to need to pay for your tuition in post-secondary institutions? So there are concerns that are there. Obviously, the concern leads to the solution. So if you're an athlete, make sure you stay in shape. It's not easy without the activities, but make sure you stay in shape, especially, and also in terms of extracurricular activities that are artistic. If you're an artist, do the art. If you're an actor, practice your technique. If you're a mechanic, whatever it is that you do, make sure that you don't give it up just because you're not doing it in school. Now, there's a lot of danger related to drug and alcohol use that everybody faces, not the least of which is dependency. We depend upon these things, and that dependency is addictive, so be careful. Alcohol, tobacco, and cannabis are addictive drugs. They also weaken your immune system, which isn't a great thing to happen to you when you're facing the possibility of getting sick with a virus. And there's poor cardiovascular health and poor pulmonary lung health. So this is what I would like you to do to monitor yourself during these times. The most serious implication of drug use, including alcohol use, which is a drug, during this time of your life when your brain is still developing. It's not finished developing at 10 or 15. It takes until you're about 25 years old for your brain to stop developing. And during its development, any interruption, which can be caused by these drugs that people are taking, will result in a person being left possibly permanently without some of the most important characteristics they're going to need, some of the most important cognitive qualities and abilities that they're going to need as adults. So here are the things to watch for in yourself. Number one, do you take responsibility? If you see that the family's having trouble, if you see there's something you can do to help out, do you jump in and say, listen, I'll do that, Mom, Dad, let me help you out with that? And if you do something and you screw up in some way, do you take responsibility? If you do, you're on your way to adulthood. If you don't, be careful. You're not yet at adulthood, and your drug use could prevent that from ever happening. And not taking responsibility will hurt you badly in the future in terms of your occupation and your relationships with other people. Do you respect when other people disagree with you? Do you realize that not everybody sees the same thing as you do the same way? Do you insist on being right? If you do, then you're not an adult yet. And if you're not an adult yet, be careful. If you're going to use these drugs before your brain develops into a fully adult brain, you may never get those qualities, and that's going to hurt you in the future. And by the way, there is a future, and in that future there are consequences to what you're doing now. And if you realize that, if you say to a kid, look, don't run out in the street, you're going to get hit by a car, you're recognizing there's a consequence. Well, what are you doing now for which there are consequences? And if you don't have a full understanding of that, be careful. Using drugs at this time of your life could be very dangerous because you'll never have that ability. And that's going to be very, very important. Do you make good choices, finally? Now, this is something that people say, and they say it offhand, and they seem to be, feel that you know what they're talking about, or they know what they're talking about. Here's what it is. If you have a choice to make, the question is always, what do I get if I make this choice? And what is it going to cost me? And if the cost is more than I can afford, either financially or in terms of my health or my social life or my academic life or my future career, then I'm not going to pay the price. So I'm not here to tell you what to do. I would never do that. It's not my role to tell you what to do. But I feel it's my responsibility to let you know that if you do certain things, there is a price, and this is the price. So knowing that price, I trust that you'll be able to make good choices. So be careful about your use of alcohol during this time. Be careful about your use of smoking and vaping and cannabis use during this time. Be well, be safe. We're almost through it. Don't stop trying now.